Hello everyone. So let's start with the session. So today's session is about arm, a very important topic which you have to know. And here you have to know about the structures lying in the arm, the anterior compartment, the posterior compartment, what are the muscles lying, the arteries and the nerves. And before exactly starting this session, I want everybody to know the questions being asked in the previous year of examination, that is for both the viva and the viva, practical and theory university exam. So you should be knowing the muscles supplied by musculocutaneous nerve and the events occurring at the level of insertion of coracobrachialis muscle. You should be knowing about the branches of profunda brachii artery, brachial arteries. You should be knowing about clinical importance of brachial artery. So exactly, I want you to see these all structures which is shown and the questions being asked. Actually, these are the important things. We should also study about cubital fossa, floors, content, clinical anatomy. So all these questions will be asked in their viva and the practical exam. So let's start with the session. So I want everybody to know about important structures which we will study. So the most important part is before starting the session, which all muscles are located. So exactly if I talk about anterior compartment, so exactly if I'm talking about anterior compartment, the important structures lying in the anterior compartment muscles are three. So we will have three muscles in anterior compartment and one muscles in the posterior compartment of arm. So we have got biceps brachii muscle. We will have coracobrachialis muscle. We will have brachialis muscle and we will have triceps brachii. Okay, so these are the muscles which are the muscles of anterior compartment of arm which you have to know. And after that, let's also see a section. So these are the muscles of arm, entire arm. So I just want you to show this image. Actually, this is a section. And at the section of the arm, what we can appreciate here, important structure. So we can see here, biceps brachii muscle, long head and the short head has been shown. We can see here the brachialis muscle. We can see here also the important posterior aspect. We can see the other muscle. So we can see here the triceps muscle. All the heads of triceps muscles which we are seeing. We can see the three heads of the triceps muscle, the medial, lateral and long head. Okay. So actually we have got the biceps brachii. We have got the brachialis muscle. We have also got the coracobrachialis muscle, and we can see the medial and lateral intermuscular septums, and we can see the nerves. Okay, so different nerves are traversing through the arm. We know that the course of radial nerve, medial nerve and all are traversing, but if I talk about the muscles of anterior compartment of arm, it is biceps brachii, coracobrachialis and brachialis muscle. Okay, so yes, brachialis muscle is already shown to you, and we have got the biceps brachii muscle also seen is visible here. So basically these are all structures. Along with the posterior aspect, we can see the three triceps muscles and we can see the important structures. But what is important for you to know that which structures are considered as the content of anterior compartment of arm. So we will have muscles. In this category, we will have nerves and we will have the artery. So if I talk about the muscles, we have got three muscles: biceps brachii, brachialis, and my dear students, also coracobrachialis muscle. So in short, we tell these muscles as BBC. You must be knowing the BBC channel is there, news channel is there. So BBC is the short form of the structures residing in the anterior compartment: biceps brachii, brachialis and coracobrachialis. What about the nerve? The nerve which is supplying these BBC are musculocutaneous nerve. So musculocutaneous nerve is the nerve of anterior compartment of arm. And if I talk about artery, it is the brachial artery. Okay. Other than this, we have seen in the section, transfer section, that structures. So these are the important contents which are the content of anterior compartment of arm. But addition to these above structure, following structures are also passing through anterior compartment of arm. That is median nerve, ulnar nerve, and the radial nerve. Okay, now one by one, we will talk about each individual muscles. We will know about the attachment, nerve supply, and action. So please see this image. So here you can obviously see that coracobrachialis are on the deeper aspect overlapped by the short head of biceps brachii. So in this section also it was not seen because of that reason. So you can see coracobrachialis is covered by the short head of biceps brachii. So two muscles are lying very close, short head of biceps brachii and coracobrachialis attached to the coracoid process as shown in this diagram. So this is the coracoid process which is shown in this diagram. Okay. So here we have got two heads. This is the long head of the biceps brachii muscle. This is the short head of biceps brachii muscle. So firstly, we will talk about the biceps brachii muscle. So if I talk about biceps brachii muscle, it has got two heads. And if I talk about short head, it arises from the coracoid process along with the coracobrachialis muscle, which is shown in this image. If I talk about the long head is actually arising from supraglenoid tubercle of the scapula, which supraglenoid tubercle of the scapula, as you can see, and study class long head of biceps brachii, we have seen that it is traversing through the bicipital groove. The two heads join together and they form a belly, and together they are inserted in the radial tuberosity. So where is this biceps brachii muscle? So here deeper muscle, the brachialis muscle is also shown. So actually in this diagram, we can see the three BBC muscle. Together we can see the BBC muscle. We can see the two heads of biceps brachii. We can see on deeper aspect we have got brachialis muscle, and in green color the coracobrachialis muscle. So now one by one I want you to know about the attachment. So when I am talking about biceps brachii, we can see it is two heads are there. We have got long head and short head. So this is the coracoid process. So this is the short head of biceps brachii and this is the long head. This is the long head of biceps brachii. Now it is important for you to know about the origin of short head and long head of biceps brachii. So please write down. When I am talking about long head of biceps brachii, the long head of biceps brachii is originating from, if I talk about origin, the long head is originating from supraglenoid tubercle of the scapula. So it arises from supraglenoid tubercle of scapula. And in the studies session, shoulder joint, I have told you the long head of the biceps brachii is intracapsular in origin. The short head arises from so along with coracobrachialis, it is arising from the coracoid process of scapula. Got it? Now after this, let's see the insertion. So when I just see this diagram where you can appreciate the insertion of biceps brachii muscle. So here we can see the biceps brachii tendon is inserting. So which bone is this? This is the radius bone. This is the radius bone. And this is the ulnar bone. So actually the tendon of biceps brachii is inserting onto the posterior aspect of radial tuberosity, and on the deeper aspect, medial aspect, it forms a bicipital aponeurosis which is going towards the ulnar bone. So that is important for the insertion. So let's talk about insertion of biceps brachii muscle. Okay, let's talk about insertion. So in insertion point number one is biceps brachii inserts onto the posterior part of radial tuberosity. Okay, basically it inserts onto the radial tuberosity, and it's and also as deep fascia on medial aspect of forearm, as a deep fascia on medial aspect of forearm, that is in the form of bicipital aponeurosis, and this aponeurosis is traversing towards the ulnar bone, as you can see in the diagram. Okay, so this is important, and the structure which is lying beneath bicipital aponeurosis. So this medial aspect extension which is called as bicipital aponeurosis, we have to know the structure exactly lying beneath the bicipital aponeurosis. That structures which is lying beneath it is beneath structures. Beneath structures are brachial artery and median nerve. Brachial artery and median nerve. Okay, so basically bicipital aponeurosis is overlapping these two structures. Okay, now after that, let's talk about the action and innervation. So let's talk about action and innervation of biceps brachii muscle. So basically, biceps brachii muscle is a strong supinator of forearm, and when the elbow is flexed, so that is, it is an important, it is also a powerful flexor of forearm, and it is also actually slightly flex the shoulder joint. So it is a strong, so actions are multiple. So we should write all the actions. Biceps brachii has got following action to perform. Okay, so first it is a strong supinator. This action occurs, this action occurs when the elbow is flexed. Now, the other action, it is a powerful flexor of, it is also a powerful flexor of forearm when the elbow is extended. Okay, now it is also a weak flexor of shoulder joint. So that means biceps brachii has got multiple action to perform. It has got multiple action to perform. Now talking about its nerve supply. So as I told you, all the muscles of anterior part of the arm is supplied by musculocutaneous nerve. So nerve supply will be musculocutaneous nerve. And it is also important for you to know that musculocutaneous nerve is formed via ventral rami of C5, C6 and C7. So what is the root value? C5, C6 and C7. Musculocutaneous nerve is an important nerve being the branch of lateral cord of brachial plexus. So done with this. Now let's talk about the second muscle. The second muscle which you should know is coracobrachialis muscle. So you can clearly see in this image that this is the coracobrachialis muscle which has been shown to you. This is the coracoid process, and this coracobrachialis muscle is actually attached to the tip of coracoid process. So it originates from the tip of coracoid process along with the short head of biceps brachii, which I have already told you, and where it inserts. So this bone is the humerus bone. Can you see here? This is the humerus bone. So it is inserting into the middle medial aspect of the shaft of humerus bone. Okay. So let's write about origin and that of insertion. So origin is from the tip of coracoid process of scapula. Okay, I'm not writing it once more, that along with the short head of biceps brachii, number of times I have told you. So you just remember both these muscles arises from the coracoid process, coracobrachialis and short head of biceps brachii. What about insertion? So you can see the insertion of this muscle, coracobrachialis. The insertion of this muscle happens to be it inserts into the middle of medial border of the shaft of humerus bone. Okay, done. Now what about the innervation? So if I talk about innervation and action, so let's know about the nerve supply. So nerve supply will be again the similar nerve, that is musculocutaneous nerve. And it is, if I talk about action, so it is weak flexor and adductor of arm. So many times, multiple times, these has been asked in the examination also. Okay, this is very important for you to understand. Okay. So let's further talk about the morphology of coracobrachialis muscle. So that is also important for you to understand what is the morphology of coracobrachialis muscle. So actually, if I talk about morphology, it represents the muscle of medial compartment of forelimb of the quadrupes, and it is basically it is which is actually not well developed in case of human beings. That is important for you to understand. Okay, so actually, if I talk about this muscle, it is important for you to understand that the in animals, actually, this can have a lower head, and in human beings, this has been disappeared. So the lower third head has disappeared in humans, but in animals, it is still there. But occasionally, the lower head or the third head of coracobrachialis muscle can be persisting as a ligament. That is called as ligament of Soothers. So this ligament will extend between the supratrochlear spur and that of medial epicondyle of humerus. So that is the important point which you can write. So please write on note point. This can be asked in the viva question if you gives a very good answer in your examination. So let's talk about. There we will write about the morphology. So in animals, as I told you, we have got 3 heads of coracobrachialis muscle. In the human beings, we have got just 2 heads. So the third head of coracobrachialis muscle disappeared in humans. Okay, but occasionally or sometimes its lower third head can persist as ligament. And what is the name of that? That is called as ligament of Struthers. And it is, what is the extent of this ligament? So if I talk about extent of ligament, this extends from, it is extending from supratrochlear spur, or you can say supratrochlear spur, that is extending, which is connecting. This is supratrochlear spur, which will be joining to that of the medial epicondyle of humerus. Okay. Now, other than that, it is actually, so basically what happens if I talk about this supratrochlear spur extension towards the medial epicondyle of humerus called as ligament of Soothers. So deep to this, we have got the medial nerve and the brachial artery that is passing. If it is present occasionally, then it can compress the medial nerve and brachial artery. This is again another important point about this ligament, that if it is present, it can compress. So this ligament of Soothers can compress. So what it can do, it can compress 2 structures, that is brachial artery and medial nerve. I have written in short. Compression can happen. Okay. So now done with this. Now let's exactly why I want you to write all these important points. Actually, the insertion of the coracobrachialis muscle, which was in the shaft, that is middle and medial aspect of the shaft. So it is an important landmark where the coracobrachialis muscle is inserting, because certain changes occurs at that landmark. Okay, why it is important? Because certain anatomical changes are occurring at the level of insertion of coracobrachialis muscle. Already I have told you about coracobrachialis muscle, that is, it is inserting in the middle of medial border of the shaft of humerus bone. And what changes are there? So we can see the circular shaft of humerus bone will become triangular at this location. So first point, circular shaft of humerus will change, it becomes triangular at this level. Got it? Then we have got the change of direction of brachial artery. Brachial artery passes from the medial side of its arm and it will go towards the anterior aspect. This is another change. So brachial artery passes from or traverses from medial side of arm to anterior aspect. Okay. The other important point is nutrient artery pierces the humerus bone at the level of insertion of coracobrachialis muscle. Actually, this can come as an enumeration question or can be asked in the viva examination. Okay. Coming to the next question, number 4. So other than that, also there is a vein on medial side that is called as basilic vein, which will pierce the deep fascia. Basilic vein pierces the deep fascia. Okay. Now, other important changes which is happening at this level. So basically, if I talk about other important point which is happening at this level, median nerve crosses in front of brachial artery, and this changes happens, and they again it will change its direction from lateral to medial side. So this is the directional change of medial nerve which is happening at the level of insertion of coracobrachialis muscle. So median nerve crosses in front of brachial artery and brachial artery from lateral to medial side, And we have got radial nerve which pierces the lateral intermuscular septum at this level. Radial nerve pierces the lateral intermuscular septum. Okay. And exactly other than that, if I talk about ulnar nerve, it also pierces the medial intermuscular septum at this level. Okay. So ulnar nerve will go posteriorly at this level. So ulnar nerve. So that means radial nerve will pierce the lateral intermuscular septum and will pass from posterior aspect of the arm to that of anterior aspect. And if I talk about ulnar nerve, it pierces medial intermuscular septum and it will go towards the posterior compartment. Okay. Okay, so this is an important change. Other than that, another change is that of cutaneous nerve. So basically, medial cutaneous nerve of arm and forearm pierces the deep fascia at the level of insertion of coracobrachialis muscle. So medial cutaneous nerve of arm and forearm. Okay, this pierces the deep fascia. So, okay, we have done with these changes which happens at the level of insertion of coracobrachialis muscle. Now, let's talk about the third muscle of the anterior compartment of arm. And the third muscle is brachialis muscle. So, let's see this muscle, the bulky muscle. So, it is actually present in the lower anterior aspect of the humerus bone. Actually, you can see lower half of the shaft as you can see here. So, it originates from, let's talk about origin. So you can see brachialis muscle is lying on the lower half of the humerus bone. So basically in the front part of the humerus bone. So it originates from the anterior lower half of shaft of humerus bone. Okay. Now coming to the insertion point, what you can see, it is going towards the ulnar bone. So this is which bone? This is the ulnar bone and this is the radius bone. So its insertion is going towards the ulnar bone coronoid process. So let's see here. This is the insertion point of brachialis muscle. So insertion, as you can see in the diagram, the insertion is, it is brachialis muscle is traversing onto the medial aspect and going towards the coronoid process of ulna. Insertion of brachialis muscle. It inserts onto the coronoid process of ulna and also the ulnar tuberosity. Okay. Now talking about brachialis muscle action and nerve supply. So I think it's fully clear to you that nerve supply is musculocutaneous now. But I just want everybody to know about brachialis muscle, that this is an example of hybrid muscle or a composite muscle. Any students, if they are not understanding anything, please let me know. Okay, I will clear your doubts right itself when the session is going on. So brachialis muscle, let's talk about its nerve supply. So this is a composite or hybrid muscle getting innervation from two nerves. The primary nerve supply is via musculocutaneous nerve, that is the nerve of anterior compartment of arm, and the other nerve supply is, it also receives innervation from radial nerve. So that is the reason it is called as the hybrid muscle. And let's talk about the action. Let's talk about the action. So when I talk about the action, it is a strong flexor of elbow. Of elbow joint. And as it is a strong flexure of elbow joint, so it is also called as, the other name which is given to you, it is called as workhorse of elbow joint. Okay, this is an important action which you have to understand. So we have finished with all the muscles of anterior compartment of arm. Now next is to know about the muscles in the posterior compartment of arm. So in the posterior compartment of arm, we have got one muscle, that is triceps. But the triceps is having three heads of origin: lateral head, medial head and long head. We have got three heads of origin about the triceps muscle. Triceps is a large muscle in the posterior compartment of arm. So first thing is to know about origin. Okay, so basically let's see the muscle. So exactly, it is having long head, it is having lateral head and it is having medial head. Three heads are there. So basically if I talk about long head, as you can see in the diagram, it is attached to infraglenoid tubercle. So if I just enlarge this image, what you can appreciate, the long head is arising from the infraglenoid tubercle of the as you can see, it is attached to infraglenoid tubercle, as you can see, to the scapula, and lateral head is arising from the oblique. So basically lateral head from the oblique ridge above the spiral groove, so from the spiral groove of upper part of the humerus bone, and medial head from the posterior surface of the humerus below the spiral groove. So that means the three heads has got origin from different areas. Long head from infraglenoid tubercle of scapula, the lateral and medial head from the posterior surface of the humerus shaft. The lateral head is actually from the posterior surface of the upper to the spiral groove, and medial head from the posterior aspect of the shaft of humerus below the spiral groove. So this is about its origin. And what about its insertion? So when I am talking about insertion, all these three heads, that is the long head, that is the M for medial, and that is L for lateral head, will form a common muscle, belly and tendon, and this will be inserting into the ulnar bone. So which bone is this? This is the ulnar bone. So it is inserting onto the olecranon process of ulnar bone. So it is inserting on which structure? Olecranon process of ulnar bone. Okay, what is this? This is olecranon process. To be more specific, superior surface of olecranon process of ulnar bone. So this is about origin insertion. So let's write it. So firstly, I want everybody to write about the origin of. Okay, so before that, I want everybody to write about the structures which is important to be known to you. So if I am talking about important structures which is lying in the posterior compartment of arm, so basically if I talk about important structures, the important structures which you are seeing in the posterior aspect is about the triceps muscle. So that is very important that you should be knowing about triceps muscle, which is a very important structure traversing here. Okay, so triceps muscle is an important, and what is its innervation? It is coming from the radial nerve. So we have seen here, let's write about that. So firstly, I would like to write about origin. Okay, so origin is from three heads: long head, originates from infraglenoid tubercle, tubercle of scapula bone. Then coming to lateral head. Lateral head arises from oblique ridge above the spiral groove of humerus bone. And medial head. The third important head is the medial head. And medial head is arising from, if I talk about medial head, it arises from the posterior surface of lower half of shaft of humerus. Okay, this is about origin of the triceps muscle. Let's talk about the triceps muscle insertion. So if I talk about insertion of triceps muscle, the triceps muscle is inserting into like a common tendon. These three heads will form a common tendon. The medial head, the lateral head, and the long head will fuse and form a common tendon, which will insert into the olecranon process. So superior surface of, so to be more specific, posterior part of superior surface of olecranon process of ulnar bone. So done. So we have finished all the muscles, and which is, if we have finished all the muscles of the arm, and if I talk about its innervation, so basically innervation, so basically if I am talking about nerve to long head, all is from radial nerve. So nerve to long head will arise, so will arise in axilla. From which nerve? From radial nerve. Okay, now coming to the nerve innervation to lateral head. So if I talk about innervation of lateral head, it also arises from radial nerve in the radial groove. From radial nerve in the radial groove. And nerve to medial head. Okay, so basically so these are getting innervation from radial nerve, and these are getting innervation from the radial nerve, and that is also from the radial nerve. In the radial groove, lower parts. That is important for you to understand. Now coming to the action. So if I talk about action of triceps muscle, it is a powerful extensor of elbow joint. So that is important for you to know that the action is, it is a powerful extensor of elbow joint. Okay. Done. Now the next topic. So we have finished with the muscles. We have finished about the muscles of anterior and posterior compartment of arm. Now we will have to study an important reason which comes as a short note question, also for image making question, that is cubital fossa. Either MCQ can come about its content, its roof structure, its floor structures, its boundaries. So we have to know the cubital fossa in detail. So for that I will make a diagram also. Firstly, let's understand. So can you appreciate this triangular area of depression which is lying anterior to elbow joint here? This triangular area of depression is the cubital fossa. So it is actually this triangular area. So if you want, I can just highlight this triangular area. So this exactly is the cubital fossa. Okay, this is exactly cubital fossa. And if I talk about base of cubital fossa, this is formed by an imaginary line which is running between lateral and medial epicondyle of humerus bone. If I talk about its lateral boundary, it is formed by brachioradialis muscle. Can you see here? This is the brachioradialis muscle. So it is formed by BR, the medial border of brachioradialis muscle. And if I talk about its its medial boundary, so medially it is bounded by pronator teres muscle. So it is bounded by the lateral border of pronator teres muscle on the medial aspect. So that means this is medial aspect and this is the lateral aspect of cubital fossa. What about the apex? The apex is lower down and the apex is formed by the brachioradialis muscle overlapping over the pronator teres muscle. So this is the boundary of cubital fossa. Thereafter, we have to know about the roof structures and we have to know about the floor structures. So firstly, I want everybody to write down the boundaries. So first thing which is important for you to write is the boundaries of cubital fossa. So the boundaries are following. It is bounded laterally by medial border of brachioradialis muscle. It is bounded medially by pronator teres muscle, lateral border of pronator teres muscle. Its base is formed by imaginary line imaginary horizontal line joining medial epicondyle and lateral epicondyle of humerus bone. What is, I have written in short ME and LE, that is medial and lateral epicondyle of humerus bone. Apex. Apex is formed by the brachioradialis muscle overlapping over the pronator teres muscle. So meeting, or you can say meeting of lateral and medial border. Okay. Now, let's talk about floor also here itself. If I talk about the floor is having two muscles. Okay. So the floor is having two muscles, brachialis muscle in the upper part and the supinator muscle in the lower part. So the floor muscle are two. We have got brachialis muscle in upper part and we have got supinator muscle in the lower part. Okay. Thereafter, we will also talk about the roof. So thereafter, I just want, yeah. So please have a look on this image. So why I am showing you this image? Because I want you to show the floor muscle. So this is brachioradialis muscle forming the lateral boundary. This is pronator teres muscle forming the medial boundary. Imaginary line, horizontal line, which is passing through lateral and medial epicondyle of the humerus bone. This is forming the base. And this is the apex where these two muscles are joining, the two boundaries are joining. This is the apex where the brachioradialis muscle overlaps over pronator teres muscle. So yes, we have got these structures. Now what about the about its floor? So you can see this is the cut part of biceps brachii muscle, which is so this is biceps brachii muscle, BB. What is this? This is the cutted, okay, and only tendon is seen. And in the floor deep to biceps brachii muscle, we have got brachialis muscle. So which muscle is this? This is the brachialis muscle, which is forming the floor upper part, and this is S. What I have written? S. This is S. What is S? S is supinator muscle. So here S stands for supinator muscle, which is forming the floor of the cubital fossa in the lower part. And so these are the floor structures. Then we will talk about the roof, and then we will talk about the content. So now coming to the roof. So see here, if I talk about the roof will have the skin. So whenever we go for the dissection, the first thing which is incised is the skin. Beneath the skin, we will have superficial fascia, which will contain veins. So we can see two veins. Can you see here? We have got cephalic vein laterally, and we have got basilic vein medially. And these two veins are connected by another vein, that is median cubital vein. So we will have these structures which is residing in the superficial fascia of the roof. And deep fascia is strengthened by bicipital aponeurosis. So also in this diagram, you can see medially there is an extension which is going. I'm showing you with the green color. This extension is from the biceps muscle, and this is the bicipital aponeurosis. Other than that, we have got medial cutaneous nerve of our forearm as the content, and we have also got here, we will also have lateral cutaneous nerve of forearm. So these are also the content in the roof. So all these structures are residing in the roof. Okay, so many other muscles, I will also show you the extensions and the contents. So now please write on the roof. Roof of cubital fossa. So when I talk about the roof of cubital fossa, it is having skin, it is having superficial fascia, and the superficial fascia of the roof of cubital fossa contains median cubital vein, which is connecting basilic vein and that of cephalic vein. Cephalic vein will be lying laterally, and we will have the basilic vein. Also, we will have medial and lateral cutaneous nerve of forearm. And if I talk about the deep fascia, the strengthening of deep fascia is done by bicipital aponeurosis. So deeper if you go, then deep to these structures, we will have bicipital aponeurosis. So deep fascia will be there, and this will be formed by bicipital aponeurosis. Strengthening will be done. So this is strengthened by bicipital aponeurosis, which is actually aponeurotic extension of the medial aspect of the biceps brachii muscle. Okay, so done. So we have seen the roof structures also. Now thereafter, we will talk about the content. We will talk about the content. So important mnemonic is there to understand the content of the cubital fossa, that is MBBS and MBBR. So basically the content. Firstly, let me describe the content. So let me just slightly enlarge this image. So as in this, you can see the mnemonic is MBBR. So this is from medial to lateral. This mnemonic is from medial to lateral. So the first content which I am highlighting is the median nerve, medial most. Close to it is the brachial artery. And then we have got this third structure as the content, that is biceps tendon. And the fourth content is the radial nerve. This is the fourth content, that is the radial nerve. So these are the four contents of cubital fossa. So let's write it there, the content. So please write down the content of cubital fossa as you proceed from medial to lateral. Okay, the mnemonic is MBBR. MBBR. M for median nerve. Actually, medial nerve will leave the cubital fossa passing through the two heads, in between the two heads of pronator teres muscle. Brachial artery, exactly at the neck of radius, the brachial artery will divide it into the two of its terminal branch, the ulnar and the radial artery. So brachial artery, which will divide the neck of the radius bone into terminal branches, radial and ulnar artery. We will have biceps tendon, which is traversing through the radial tuberosity to get inserted, and R for radial nerve. Okay, if I talk about radial nerve, it gives superficial and deep branch. Deep branch will penetrate the supinator muscle, and superficial branch will go laterally lower down and ultimately will reach the anatomical snuff box. So these are the contents of cubital fossa. Okay, so many questions has been asked from the cubital fossa content and the cubital fossa boundaries, roof and floor. Now in examination, it is always as questions come from cubital fossa. One of an important point is that you should make a schematic diagram showing the boundaries and the content of cubital fossa. So let's draw a diagram, then we will see the, so let me just enlarge this. Then after that, we will also see the important, so let's draw a diagram showing the boundaries and the content of cubital fossa. Okay. Yeah. So for that, I would like to just an outline slightly of this anterior to elbow. This is the arm lower part. Then this is the outline of the bony things. You got it. This will be the lower part of the humerus bone. And exactly can we use another color to denote the base. So if we want, we can just have this lower down. It is from medial and lateral epicondyles. So like this. This is the base of the cubital fossa. Got it? This is the base. So if you have, so basically, just to make you understand, we can use a dotted line for that, for the base. So this dotted line is the base. Is it okay? This is the base of cubital fossa. Now, we will also draw here the outline of, it will be this will be the cut section, this will be the muscle, biceps. Okay, so we will have this as the here I just want you to write here L, and this is M. What is this? M for medial and L for lateral. Okay, so this base is connecting lateral and medial epicondyle of humerus bone. Okay, that is clear to you? Okay, done. That is an imaginary line. Okay, this will be the biceps tendon, and we can make the outline also. Okay, this was okay only. This was okay. So basically for the muscles and all, we can use the brown color. Okay, let me shade it afterwards. And here we will have this as the pronator teres muscle. Okay, so let me use brown color for the muscles. I will slightly darken it. Okay. And this is also the muscle, biceps brachii muscle. Okay, got it. So let me just shade it like this. These are the muscle fibers. Okay. Now, here, let's label it, my dear students. So, yes, we will label it. This muscle is brachioradialis muscle and this muscle is pronator teres. And this is pronator teres muscle, which is forming the medial boundary. So we have got the boundaries and let's see the content inside. So for the contents, I will use yellow color for the nerves. This is the nerve. Then we will have red colors for the arteries. Got it. Here we will already having the biceps tendon here. This is the biceps tendon. And more laterally, we will have the radial nerve. Okay, now just outline these structures. Always make lumen in the vessels. Just label it. Okay, so we have got all the 4 contents and we are going to label it. So if I talk about contents, you can write down the heading content. Okay, we can just write down the heading. So I will use, okay, content of the cubital fossa. Okay, content, and in bracket you can write medial to lateral. Medial to lateral. So the first content will be, okay, so this is M, you can rough from here. You can write here M. So the first content is median nerve. What is the second content? The second content is the artery, brachial artery, which is dividing into radial and ulnar artery, which is the third content. The third content is the biceps tendon. And which is the fourth content? The fourth content is the radial nerve. So yes, my dear students, we have got the boundaries and the content of cubital fossa. So we are able to show the boundaries and the content of cubital fossa. Okay, so you just make one diagram showing, so this is the apex, lower down you can say this is the apex. So we can see the apex, we can see the base, we can see the lateral and the medial border of the cubital fossa in this single diagram. Okay, you can make one more diagram showing the roof structure of the cubital fossa. So let's make one more diagram, then I will show you few cadaveric images. Is it okay? Yes, so I just want to use this space. Okay, so just make one more diagram so that we can have a look on the. Okay, so let's make a diagram. Structures in the roof of cubital. What will be the heading? The heading will be structures in the roof of cubital fossa. Okay, structures in the roof of cubital fossa. Got it? Yes. Now again, I will make an outline of arm. Got it? Then I will make two veins medially and laterally. So there should be a lumen. Huh? So there should be a lumen. So one vein on the lateral aspect, one vein on the medial aspect, going like this. Okay. And these two veins will be connected via median cubital. Okay. So just use blue color for the veins. A clear diagram. Okay. So here we will have these two veins. So just label it. So this is the basilic vein, which will be lying medially. This will be, so close to it, we will have the medial cutaneous nerve of forearm. Just a minute. Like this. And close to the lateral side cephalic vein, we will have lateral cutaneous nerve of forearm. Got it? So then label it. So this is cephalic vein. This is medial cutaneous nerve of arm and medial cutaneous nerve of forearm. Medial cutaneous nerve of forearm. And this is lateral cutaneous nerve of forearm. And this connecting vein is the median cubital vein. Also, you can just show the bicipital aponeurosis also. Okay. This is the bicipital aponeurosis. Okay, so all these structures are present in the roof of the cubital fossa, which I have drawn. Okay, so we have got all these structures seen in the roof of cubital fossa. So done with this. Now, I would like to tell about the clinical anatomy related to this. So let's talk about the clinical aspect. So clinical significance of cubital fossa. So if I talk about clinical anatomy, important significances are following. So one of the important significances about the median cubital vein. Actually, median cubital vein, which is lying in the cubital fossa roof, in the superficial fascia of the cubital fossa, it is pierced normally for taking blood samples. Why? Because it is strengthened on posterior aspect by the bicipital aponeurosis. So median cubital fossa, median cubital vein is used for taking blood samples for the investigation purpose, blood samples. Also, actually, if I talk about, it's very, if you flex also, you can see, you can palpate by your fingers the biceps tendon, and just medial to biceps tendon we have got brachial artery. So that is brachial pulse. Brachial pulse is taken here for recording blood pressures. Okay, it is commonly utilized, and it's very easy to know the brachial pulse. Why? Because when you palpate, it can be easily felt. So brachial artery, this is taken from brachial artery, pulsation medial to biceps tendon. Which is located median to biceps tendon. Okay, now also, actually, it's also important that whenever there is an injury to the supracondylar ridge of humerus, so if there is a fracture of elbow, and the supracondylar fracture is there, supracondylar fracture of the humerus bone around elbow joint, the content of cubital fossa is specially compressed. So which content of cubital fossa is compressed? Mainly whenever the fracture of the supracondylar fracture of humerus is, when vulnerable structure to get compromised, compressed, is that of the brachial artery and also the median nerve. Because these are located medially in the cubital fossa. So these are important clinical anatomy related to the topic. Okay, now let's talk of another important artery, that is brachial artery. So already we have completed axillary artery in the previous session, and if I talk about brachial artery, it is the main artery of the arm, and exactly the continuation of axillary artery beyond teres major muscle. Exactly the axillary artery will change its name to brachial artery. So brachial artery is the main artery of arm. It begins at the lower border of teres major muscle as a continuation of axillary artery. And exactly if I talk about its termination, so it will terminate at the neck of, and it terminates at the neck of radius, at the level of neck of radius, into two terminal branches. And what are the two terminal branches? The two terminal branches of brachial artery is the ulnar artery and radial artery. Got it? Okay. Done. Now, let's see this image. So this is a schematic diagram showing you the brachial artery. So basically, brachial artery, what is exactly you should know? You should be knowing about its important branches. So it gives muscular branches. This is the brachial artery, and you can see this is the teres major muscle. Above it, it is axillary artery, and from the lower border of teres major muscle, this is changing its name and forming its, this is actually called as the brachial artery at the lower border of teres major. So it will give muscular branches. One of the largest branches, profunda brachii artery, as you can see, which is the largest in the first branch. It is given from the posteromedial aspect. Of brachial artery. Other branches are superior ulnar collateral artery, inferior ulnar collateral artery. Sometimes it gives nutrient artery to humerus, because most of the time nutrient artery to humerus gets from the profunda brachii artery. It gives muscular branches, as you can see. Okay, it gives muscular branches. It gives two terminal branches, radial and ulnar artery. So all these are the branches of brachial artery. So I want everybody to write about the branches of brachial artery. Branches. Okay, it is important for us to know the branches of brachial artery. So the branches are, it gives muscular branches to the surrounding muscles in this area. It gives profunda brachii artery, which is the largest branch of brachial artery. You can say it is largest and first branch. And it is given from the posteromedial aspect of so profunda brachial artery arises from posteromedial aspect of brachial artery. Okay. Now, other branches, nutrient artery is also given to the humerus bone, but please write down, it is not always, sometimes, most of the time, nutrient artery is given by profunda brachial artery. It also gives superior ulnar collateral artery, inferior ulnar collateral artery, superior ulnar collateral artery. It gives inferior ulnar collateral arteries. It also gives two terminal branches, and the two terminal branches are at the level of neck of radius, radial artery and ulnar artery. Okay, these are the branches. Okay, done. Now, okay, if so in brachial artery, you can superficially, some important points of relations of brachial artery is also important and has been asked in the viva exam also. And if a short note comes, you have to make a diagram showing the branches, write down the branches, the origin, extent of brachial artery, where it is terminating, the relations, the branches, and a diagram. So brachial artery anteriorly. So let's talk about anterior relations. So we are talking about relations of brachial artery. We are talking about relations. So on anterior aspect, anteriorly, in upper part, it is related to medial cutaneous nerve of forearm. In the upper part anteriorly, and in lower part. Now talking about the lower part. So basically, no, we can categorize in the three parts. So lower part and middle part. So it is basically in the anterior part. Please write down, categorize the relations into 3 points. Okay. So this was the first point of relation anteriorly. Now talking about the relation in the middle part on the anterior aspect. So on the middle part, it is crossed by median nerve. It has been anteriorly crossed by median nerve, which is passing from lateral to the medial aspect, and in lower part, it is crossed by bicipital aponeurosis. That means anteriorly, the brachial artery is related to 3 structures in the 3 parts. In the upper part, medial cutaneous nerve of forearm. In the middle part, crossed by the median nerve, and in the lower part by bicipital aponeurosis. Now let's talk about posterior aspect. So what structures lies posterior relations for the brachial artery? So we have done the anterior. Now talking about the posterior. This is done anterior. Now talking about the posterior. So brachial artery is actually having relation posteriorly as long head of triceps and also the medial head of triceps and coracobrachialis muscle. So posteriorly, it is related to long head of triceps, medial head of triceps, coracobrachialis muscle, and brachialis muscle. As you proceed from above to lower down, these are the structures which is related from above to down. So these are the structures which is related from above to down. So we have got the relation on anterior aspect. We have got the relations on the posterior aspect. And if you want, we will also write the relations on the medial aspect and relations on the lateral aspect. So medially, if I talk about the brachial artery, which structure lies? The ulnar nerve and the basilic vein. So medial side, we have got the relation of ulnar nerve and basilic vein. So that is related in the arm, and also basically it is important. So if I talk about the lower part, so this ulnar nerve and basilic vein is lying on the medial aspect in the upper part. In the upper part and in the lower part, we have got median nerve. And median nerve, we have seen also in the cubital fossa content that medial nerve is lying on medial aspect of brachial artery. Now, what lies laterally? What lies in the lateral relation of brachial artery? Laterally, if I talk about the median, it is related, or actually median nerve is lying on the lateral side of the brachial artery in the upper part. So in the upper part, so what you can say, upper part of arm, in upper arm, on the lateral side, it is having median nerve and coracobrachialis muscle. Coracobrachialis muscle. Okay. Got it. And basically in the lower arm, that is in the cubital fossa, the tendon. So it is having lateral side tendon of biceps brachii muscle. Okay. So we have got an idea of relations of the brachial artery, which we have just now described. And other than that, I can again show you this diagram of brachial artery where you can revise its branches. Okay. So you can just revise its branches, brachial artery. So we can see the brachial artery is giving one of its largest branch, that is profunda brachii artery. It is giving superior and inferior ulnar collateral artery. It is giving also nutant artery to the humerus bone muscular branches. Now here I just want you to show the two terminal branches, radial and ulnar. Can you see here? These are the two terminal branches, radial and ulnar. Okay. Now here, what you can see that if I am talking about ulnar artery, so few branches has been shown. So what you can see, the ulnar artery is giving intraosseous branches. Can you see here? The ulnar artery is giving intraosseous branches, which will again, so if I talk about, it is giving intraosseous branches, which will again give anterior posterior intraosseous, and the posterior intraosseous will give another branch that is called as intraosseous recurrent artery. That means these arteries which I have told you, if I talk about ulnar artery, it gives common intraosseous artery, which is again dividing into anterior and posterior intraosseous artery. The posterior intraosseous artery gives another branch that is called as intraosseous recurrent artery. Why I am focusing on this point? Because this has been asked multiple times in the competitive exam also. So that is very important. Okay. Now, okay, so after this, okay, we can make a diagram also. We can make a diagram showing the branches of brachial artery. Okay, then we will go into the details of profunda brachii artery. So exactly, if this comes in exam, you have to draw this diagram, brachial artery. Okay. So again, I will just draw an outline here, slight outline of humerus bone, and then I will draw here radius bone, neck. Okay, just to make you understand the landmarks. Okay. Okay, now here we know that teres major muscle is attached to the lateral lip of bicipital groove. So you just imagine here, this is the teres major muscle. So I will just use brown color for showing the attachment of teres major muscle. Got it? This is the teres major muscle. Got it? Now we'll talk about the artery. So this is the artery. Okay, at the lower border it will, so above the teres major muscle it is axillary artery, and below it it becomes brachial artery. So basically it is the brachial artery. So I am going to draw the brachial artery like this. Okay, after that I will draw the filling part of the lumen of the arteries. So yes, this is actually one of the, its largest branch should also be focused and drawn here. So this branch will be the profunda brachii artery. Okay, so now we can use red color for filling its branches. Okay, dear, so just okay. This is the artery which has been drawn, the lumen and all. Okay. Now, let's label few important points. So here we will have this as the teres major muscle as the landmark. Okay. And this is the axillary artery. Above this level, this is the axillary artery. Okay. And this is lower to it. So basically, this part is the brachial artery. That means this is the brachial artery which we are talking. And one of its important branch, the first branch which is given on the posteromedial aspect, this artery which you are seeing is the profunda brachii artery. You can see it is running in the medial aspect, posteromedial, profunda brachii artery. Okay, other than that, it will give, profunda, I will just like to show the important branches of brachial artery. So let's show the important branches of the brachial artery. So brachial artery is giving branches that is the superior inferior ulnar collateral arteries. So these branches are ulnar collateral arteries. These are ulnar collateral arteries. Got it? So this is the arteries. Please label it. The one above is superior ulnar collateral artery. This is superior ulnar collateral artery. And this is inferior ulnar collateral artery. Got it? Now we will also have other branches which I want you to show. So it gives muscular branches also. So it is actually giving muscular branches. Okay. And this with a dotted line, we can see actually this is the, on the posteromedial aspect, actually these branches are coming. No? So with a dotted line, I want to show because it is on the posterior aspect. Okay. Okay, so this is actually the branch which is coming from profunda brachii artery. So basically also I just want to focus on the branches of brachial artery only. So brachial artery is also giving, this is the radial artery and this is the ulnar artery. Okay, so this structure which you are seeing is the brachial artery, no doubt about that. And important branches has been shown to you. Okay, so it is giving largest in the first branch, profunda brachii artery, superior inferior ulnar collateral arteries, radial arteries, and obviously the muscular branches. And also a small branch you can show like this. This is the nutrient artery. This is the nutrient artery and it gives muscular branches. These are the important branches of brachial artery which is shown in this image. Now for profunda brachii artery, actually you have to know the branches of profunda brachii artery also. You know that profunda brachii artery is a branch from the, if I talk about profunda brachii artery, it's a branch from the posteromedial aspect and the largest in the first branch of brachial artery. So that is already known to you. It is the largest branch of brachial artery. Now it is important for you to know that what are the important branches. So the important branches profunda brachii artery gives is the deltoid or ascending branch. Okay, this is going in upper direction towards the lateral head and long head of triceps. Now it is most of the time it gives nutrient artery to humerus bone. Okay, any doubt you can ask me, my dear students. It also gives anterior descending artery. And the other name of anterior descending is radial collateral artery. Okay, and it also gives posterior descending arteries. And the other name of posterior descending artery is middle collateral artery. Got it? So these are the branches which are the branches of profunda brachii artery. Okay, done with this. Now, this is a schematic diagram just to make you understand the branches of brachial artery and the profunda brachii. Profunda brachii artery is a branch from the brachial artery and posteromedial aspect. Sometimes it gives nutrient artery to humerus. Most of the time, nutrient artery to humerus is received from profunda brachii artery. Superior, inferior ulnar collateral artery, muscular, and the ulnar and radial artery. These are the branches of brachial artery. The branches from the profunda brachii artery which travels through the lower triangular space of the scapular region along with radial nerve, and it gives muscular branches to the adjoining muscles, radial and middle collateral arteries, and also it gives deltoid branches and it gives nutrient artery to the humerus bone. So all these points are very, very important for you to understand. Okay, done with this. Now, thereafter, okay, actually this is not a must know question, but it is may know question for the anastomosis around elbow joint. Okay, so there are anastomosis which is occurring around the elbow joint, and this anastomosis is occurring between the branches of brachial artery and that of the branches from the radial and ulnar artery. So they will anastomose. The branches of brachial artery will anastomose with the branches of radial and ulnar artery to form an anastomotic network. Okay, that is a very important point. So what I want you to understand this, and then I will write it. So basically I want you to see this image. Okay, I want you to see this image, everyone. So if I'm talking about arterial anastomosis around the elbow joint, easy way of memorizing the arterial anastomosis around the elbow joint. So we can just enlarge this. Slightly, I want to enlarge it. Okay, now, so we will have the anastomosis in the remembering in front of medial epicondyle, behind the medial epicondyle, in front of lateral and behind the lateral epicondyle, like this we can understand, and also above the olecranon process. So basically, firstly I make you understand. So in front of medial epicondyle, the anastomosis happens. So see here, this is the medial epicondyle level, and this is the lateral epicondyle. Okay, got it? So basically, when I'm talking about the in front of medial epicondyle, the arteries which is forming anastomosis is, so you have to understand this. So basically, it is this anastomosis is formed between inferior ulnar collateral artery, the inferior ulnar collateral artery, which will anastomose with the as you can see, a branch. So basically you can see here, this is the anterior ulnar recurrent artery and this is the posterior ulnar recurrent arteries. Okay, so actually if I am talking about in front of medial epicondyle, the inferior ulnar collateral arteries and a branch from, so basically this is superior ulnar collateral artery. Please write down, this artery is superior ulnar collateral artery and this artery is inferior ulnar collateral artery. Okay, so basically in front, so you can understand like this, the in front, so this is in front of the medial epicondyle. These two arteries are forming anastomosis. What is it? That is a branch from the inferior ulnar collateral artery. So actually inferior ulnar collateral artery along with a branch from superior ulnar collateral artery will anastomose with that of anterior ulnar recurrent artery. Okay, got it? Now posterior, if I talk about posterior aspect to medial epicondyle, so behind the medial epicondyle we have got the anastomosis which is taking place between superior ulnar collateral artery and the posterior ulnar recurrent artery. So it takes place between the superior ulnar collateral artery and a branch of inferior ulnar collateral artery with that of posterior ulnar recurrent artery. So it is important for you to understand this. Now other than that, let's talk about the anastomosis which is taking place at the lateral epicondyle. So when I'm talking about lateral epicondyle, in the lateral epicondyle, let's talk about the anastomosis which is taking place in front and behind. So in front of lateral epicondyle, the radial collateral artery. So here we will have, this is the lateral epicondyle. We will have the anastomosis which is taking place between the radial recurrent artery, which is a branch from the radial artery, with that of, okay, so we will have here radial with that of anterior descending arteries. Okay, so this will be the this is called as the radial collateral arteries also. This is forming the anastomosis as you can see here. Okay, and behind, if we talk about the anastomosis which is taking place behind the lateral epicondyle, so the branch from the posterior descending artery. Can you see here the branch from posterior descending artery? That is a branch from the profunda brachii artery, which is actually, you can see, it is forming anastomosis with that of intraosseous recurrent artery. Can you see here? And the intraosseous recurrent artery is a branch of posterior intraosseous artery, which is a branch from common intraosseous artery, and common intraosseous artery is a branch of ulnar artery. So these are important anastomosis which is taking place around the elbow joint. So how you are going to memorize it? You have to first note down the medial and lateral epicondyle. So two anastomosis is lying anterior to medial and lateral epicondyle, and two anastomosis on the posterior aspect of medial and lateral epicondyle. Okay. And also above the olecranon process, there is middle collateral artery, which will be anastomosing with the branch of inferior ulnar collateral artery. But most important is to know the anastomosis around anterior and posterior aspect of the medial and lateral epicondyle. So let's write it. Elbow anastomosis. So the first thing which I want you to understand about elbow anastomosis is the arterial anastomosis around elbow joint takes place between branches of brachial artery and radial and ulnar artery. Okay, these are forming an anastomosic network around elbow joint. Okay, I just made you understand in this diagram, and I will write the content because this is not must know topic, this is may know topic. But if you are a very good student, so definitely this question will be asked in examination in the viva. So you should know the anastomosis which is taking place. So I will categorize the anastomosis like this. One will be in front, so the anastomosis which is taking place in front of medial epicondyle. So in front of medial epicondyle of humerus bone. So the anastomosis is between these two important arteries, that is inferior ulnar collateral artery and a branch from superior ulnar collateral artery. This will anastomose with anterior ulnar recurrent artery. So it is important to know this anterior ulnar recurrent artery is branch of ulnar artery. And you already know the superior and inferior ulnar collateral arteries are the branch of brachial artery. That is already known to you. Now talking about arterial anastomosis behind the medial epicondyle. Now the next one is, this was the first point. Now let's talk about the second point, that is anastomosis behind the elbow joint. So now anastomosis behind the medial epicondyle. So behind medial epicondyle, the anastomosis is taking place between superior ulnar collateral artery and a branch from inferior ulnar collateral artery. And we know that these collateral arteries are the branches of brachial artery. This will anastomose plus sign, or you can write anastomosis with posterior ulnar recurrent arteries. With the posterior ulnar recurrent artery. And we know that posterior ulnar recurrent artery is a branch of ulnar artery. Got it? Now, done. Now, arterial anastomosis, third point, again in front of lateral epicondyle. That means, firstly, in front of lateral epicondyle. Okay. This anastomosis takes place in front of lateral epicondyle. It takes place between radial collateral artery, and we know that radial collateral artery, anterior descending artery, is same artery which are the branch of profunda brachii artery. So this is a branch of profunda brachii artery. I have written in short PBA, branch of profunda brachii artery, which will form anastomosis with, okay, this will form anastomosis with radial recurrent artery. And we know that radial recurrent artery is the branch of radial artery. Okay. Now behind lateral epicondyle, fourth point, behind the lateral epicondyle, okay, so when I'm talking about anastomosis which is taking place behind lateral epicondyle, it is between posterior descending artery. Posterior descending artery is again a branch of profunda brachii artery. It takes between posterior descending artery, branch of profunda brachii artery, which will form anastomosis with introosseous recurrent artery. Introosseous recurrent artery. And my dear students, introosseous recurrent artery, if I talk about introosseous recurrent artery, it is a branch of posterior introosseous artery. And posterior introosseous artery is a branch of common introosseous artery. And common introosseous artery is a branch of ulnar artery. Okay, so this is also important for you to know because this has been asked in examination. So these are the important anastomosis. Also in pubics, it is mentioned what anastomosis takes place above olecranon process. So that is in between middle collateral arteries and that of a branch from the inferior ulnar collateral artery. So that is, if you are writing all these four anastomosis, which is taking place around the elbow joint, that is anterior and posterior to medial and lateral epicondyle, that is more than enough. Okay, this can be asked. Also, the branches of profunda brachii artery, the branches of radial, ulnar, and the introosseous artery is a branch of which source is commonly asked in examination. So this is very important for you to understand. Okay. So done with this. So we have done with this important topic of anastomosis, which is taking place around elbow joint. If you want, you can get a quick recapitulation also, which I have shown you. Let's see the recapitulation part. Okay. So if you want, I just want to enlarge this image. Yes. Yes. So now you can see here the anastomosis, which is taking place. So just to make you understand. So anterior to medial epicondyle, it takes place between inferior ulnar collateral artery, as you can see, and the anterior ulnar recurrent artery. So a inferior ulnar collateral artery and a branch from superior ulnar collateral artery with anterior ulnar recurrent artery, and behind it takes place between superior ulnar collateral artery and that of posterior ulnar recurrent artery. Now coming to the lateral side. In the lateral side, if you will see the lateral epicondyle, we can see the radial collateral artery is there, which is a branch from profunda brachii artery. And this radial, if I talk about this radial collateral artery, it is anastomosing with radial recurrent artery. Now, if I talk about posterior descending artery, which is branch from the profunda brachii artery, it is anastomosing with the introosseous recurrent artery. My dear students, introosseous recurrent artery is a branch of posterior introosseous artery, and posterior introosseous artery is a branch of common introosseous artery, and common introosseous artery is a branch of ulnar artery. So these are showing the important anastomotic network which is found here. So we can see these anastomosis. So these are four important anastomotic network which is found around elbow joint, which you have to know. Okay. So done with this. Now let's, so I just want you to know that before ending this topic, it is important that we should solve few MCQs related to this topic. So let's see this. Okay, so one by one. So here the question which has been asked is posterior introosseous artery is a branch of which of the following artery? Radial artery, ulnar artery, brachial artery, or axillary artery? So posterior introosseous artery, just now I have explained you and shown in the image that posterior introosseous artery is a branch from ulnar artery. So we have got ulnar artery as the right answer. So those who want to solve the MCQs, they can pause the video and then mark the right answer. That is the other way to give you the right answer. So we have got the right answer. Posterior introosseous artery is a branch from ulnar artery. Now coming to the next question. Introosseous recurrent artery is a branch of. Introosseous recurrent artery is a branch of which of the following artery? Anterior introosseous artery, posterior introosseous artery, common introosseous artery, or radial artery? And the right answer is posterior introosseous artery. Introosseous recurrent artery is branch from posterior introosseous artery. Posterior introosseous artery. Posterior introosseous artery is a branch from common introosseous artery. And common interosseous artery is a branch from ulnar artery. Okay, so this is the tree which you have to know. This is the bifurcation which you have to understand. Now, branch of brachial artery is all except. Branch of brachial artery is all except. The option given is profunda brachii artery, superior ulnar collateral artery, inferior ulnar collateral artery, or radial collateral artery. Profunda brachii artery is the largest branch of brachial artery, so it can't be the right answer. Superior, inferior ulnar collateral arteries are also the branch of brachial artery, so they can't be the answer. And if I talk about radial collateral artery, it is the right answer. Radial collateral artery is also called as anterior descending branch. And this branch, radial collateral artery, is a branch from profunda brachii artery. So, all A, B, C are the branches, that is profunda brachii, superior, inferior ulnar collateral arteries. They are all branches from the source of brachial artery, but radial collateral artery is a branch from profunda brachii artery, which itself is the largest branch of brachial artery, which is also called as artery of arm, deep artery of arm. Okay. Profunda brachii artery is also called as deep artery of arm. So we have done with this. Now moving to the next. Bicipital aponeurosis lies over which of the following structure in the cubital fossa? So we have finished the topic of cubital fossa. We have seen the boundaries. We have appreciated the content. We have seen the roof structures and the structures lying inside. If I talk about bicipital aponeurosis, it is the medial and deeper aspect, the aponeurosis from the bicipital, from the biceps brachii muscle, which is going towards the ulnar bone, and it is overlapping and covering the brachial artery and medial nerve. So medial nerve is not in the option, so we will have the right answer as the brachial artery. So bicipital aponeurosis is covering two structures. One is the brachial artery and the other is the medial nerve. So the right answer in this case will be C. Moving to the next question. All are the contents of cubital fossa except the option given are median nerve, biceps tendon, brachial artery and ulnar nerve. So if I talk about a cubital fossa, which is a triangular depressed area lying on the anterior aspect of the elbow joint, it has the content from medial to lateral MBBR. Okay. So the medial most content is median nerve, then we have got brachial artery, we have got biceps tendon, and we have got radial nerve. So ulnar nerve is not the content of the cubital fossa. All other structures which is mentioned, ABC, median nerve, biceps tendon and brachial artery, is absolutely the prime content of cubital fossa. So we have got ulnar nerve as not the content of cubital fossa. So it's very important that you should be knowing about the boundaries, content, roof and floor structures in terms of cubital fossa. So we have finished with the arm, and just to give you a quick recapitulation what all things we have covered in today's session. Firstly, I have discussed the muscles. I have discussed the anterior and posterior compartment muscles of the arm. In the posterior aspect, we have 3 heads of triceps getting innervation from radial nerve. Action is extension of elbow joint. In the anterior part, we have got BBC muscle, which is getting innervation from musculocutaneous nerve, which is a branch from lateral cord of brachial plexus, having the root values C5, C6 and C7. And I have discussed about the attachment of BBC muscle and their actions also. Then we have come to cubital fossa, where I have told you the boundaries of cubital fossa is a base is formed by an imaginary line which is connecting the medial and lateral epicondyle of humerus bone. We have got laterally boundary formed by brachioradialis muscle. Medially, we have got pronator teres muscle. Brachioradialis muscle overlaps on the pronator teres muscle and will form the apex. The joining point of the medial and lateral boundary will form the apex lower down. And we will have the roof content. The roof will have skin superficial fascia containing basilic vein medially, containing the cephalic vein laterally, and a median cubital vein that is connecting the basilic and cephalic vein. And median cubital vein is always, most of the time, used for draining the blood samples for investigations. And we will also have medial cutaneous nerve of arm medially and lateral cutaneous nerve of forearm laterally as the content of roof. Strengthening this roof is strengthened by the bicipital aponeurosis. The two muscle which is forming the floor of cubital fossa, we will have the brachialis muscle above and we will have supinator muscle lower down. So this is very important that you should be knowing the roof, floor and the content. Just now I told you MBBR, the content from medial to lateral, median nerve, brachial artery, biceps tendon and radial nerve. I have also discussed about the branches of brachial artery and profunda brachii artery. As we know, lower border of teres major muscle, the axillary artery continues to become brachial artery. The brachial artery terminates at the level of neck of radius and will terminate as the radial and ulnar arteries. The brachial artery important branches are profunda brachii artery, the largest branch given on the posteromedial aspect from the posteromedial aspect of brachial artery. It also gives superior and inferior ulnar collateral artery. It gives muscular branches and the two terminal branches, radial and ulnar artery. It also gives sometimes the nutant artery to the humerus. Now, talking about the largest branch, if I talk about the largest branch of brachial artery, it is the profunda brachii artery, which is the largest branch. If I talk about the largest branch, that is profunda brachii artery, called as the deep artery of arm, which runs in the spiral groove along with the radial nerve and passes through the lower triangular scapular spaces on the back. It gives important branches. It gives deltoid branch, which is ascending branch. It gives muscular branch and it gives the nutant artery to humerus most of the time. It also gives anterior and posterior descending arteries. After that, we have discussed the anastomosis, which is taking place on the elbow joint, around the elbow joint. And we have categorized the anastomosis as the anastomosis on the medial, in front and the posterior aspect of medial epicondyle, and I have also described the anastomosis which is taking place and the anterior and the posterior aspect of lateral epicondyle. The important branches of radial ulnar artery along with the branches of brachial and profunda brachii artery will form this elbow anastomosis. So actually this is very important that you should be aware of all these anastomosis. It's highly important. So I want you to practice the diagram which I have made for the cubital fossa. So we'll make the diagram showing boundaries and the content, and you will also draw another diagram showing the roof content. So this is very important. And also understand that in the cubital fossa, if you just flex the elbow, you can feel the biceps tendon. You can feel the biceps tendon, and just medial to biceps tendon, you can palpate the brachial artery. Brachial artery is commonly utilized in this space for the recording of blood pressure. All the best. We will again meet. And if there is supracondylar fracture, the structures which can be injured is the structures of cubital fossa, that is median nerve and the brachial artery. So we will meet in another session. So do revise all the things. All important things has been described, and do make the diagram which I have made in the examination. And also an important viva question is all the structures or what changes are noted at the level of insertion of coracobrachialis muscle. If you give very good answers, you will be also asked about the third head of the coracobrachialis muscle, which is absent in humans, and Schroeder's ligament will be asked. All the best and keep studying. Again, we'll meet in the next session. Thank you so much.